45 TV thanks TRIA Orthopedics for being such a great partner in our state tournaments. Joining me now, Dr. Joel Boyd with TRIA Orthopedics. As the head team physician for the Minnesota Wild, you're the guy to ask this. What are some of the common injuries we're going to see in hockey?
Upper body injuries and lower body injuries. Usually when they're upper body injuries, it's around the shoulder and have to do with things like shoulder dislocations or AC joint injuries or clavicle fractures. Lower body injuries tend to be involve the knee. So ligament injuries around the knee joint, even meniscus tears, or ankle injuries. Sometimes players can sustain fractures by getting hit by pucks.
Let's go back to the knees. Is there anything a hockey player can do to strengthen the knee?
It's hard to strengthen the actual joint itself, but around the joint, strengthening their quads and their hamstrings and their gastroc muscles is important. It's also important to strengthen the muscles that are part of the chain around the hips, as well as your core, which includes your abdominal muscles and your back muscles.
Can hockey players, you get the dreaded ACL injury, can hockey players, should they maybe try to play through that sometimes? Can that be done?
ACL injuries really don't have the same forces as they do in other sports like basketball and football. So because it's on ice and it's a gliding sport, you don't need your ACL nearly as much. However, long-term, it's still better for them to have an ACL reconstruction.
Dr. Boyd, thanks for your time. And as always, we appreciate TRIA Orthopedics for being a tremendous supporter of the tourneys on 45.